Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back. Thank you for joining us today for this special episode. Today is part 3 of a 3-part series we have released on autism. What is autism? How is it diagnosed? What are the signs that would cause a parent or doctor to consider autism in a child? Well, today we are going to focus on treatment options and therapies for children with autism. Obviously, this has been very much in the news, and we are joined again by our special guest, Dr. Julia Jackson. If you've listened to our other episodes in this series, you know she is a doctor who specializes in child and adolescent psychiatry. She has cared for thousands of children with autism over the course of her 24-year career, and she is also the mother of 5 boys, one of whom has autism. So she has given us this incredible insight throughout this series from both her extensive clinical practice experience and that invaluable insight that comes from parenting a child with autism. So I know you will enjoy today's discussion with her as we delve into treatment options and therapies for children with autism. Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
So, Dr. Jackson, maybe you can spend a minute just describing to us, after your child is diagnosed with autism, what sort of things a parent can expect in order to help them?
Good question. So the professional that you end up seeing normally will help you identify what are the biggest stuck points, the most distressing, areas, for the kiddo or for you as a parent. Or are there comorbidities? Is there depression, anxiety, anything else? Just because they have autism doesn't mean they can't also have PTSD or bipolar disorder, all kinds of things. And so you need to first identify what's going on, what is treatable, just like you would treat any other comorbidity. And then what are the primary struggle points? So almost always what is helpful is making sure that environmental modifications are in place. And so individuals spend a lot of time at school. That's an area that often drives a lot of distress for the individual and for the families. So one area that can be really helpful is working with parents on, how to get the school system to implement the appropriate accommodations through the disability laws. So either a 504 plan or even a full IEP or individualized education plan, which just drives more services and supports in the school system.
Is autism testing, I'm assuming that type of testing is available through the school if you request? And I ask because those services are free. Like, does the school do a good neurodevelopmental evaluation to pick up on this? I know they're very versed in ADHD and learning disabilities and all of that, but...
So just in recent years, the school, I'm assuming they're still doing it, but I learned of it in the last couple of years. They're wanting to do their own assessments for autism as well. And so even if you have, like myself, I usually will write a summary letter. These are the diagnoses. These are the accommodations I think would be helpful. I have parents, submit that with the psychological testing report, if there is one, with their request for accommodations, whether it's a 504 plan or an IEP. Even with all of that, the school will still say, we're going to do our own assessment. And I think part of that is they want to assess how those particular disabilities impact their academic functioning, not so much how does it impact everything.
I'm just looking at some notes that I took on a CME that I went to recently that was about a functional behavior assessment, and that you can now request that from the school to lead to a behavior intervention plan.
Yeah, so the functional behavioral assessment I see most commonly with kids that have really explosive, the externalizing diagnoses. So, and it can be anything. It can be ADHD kiddos can be incredibly explosive. Bipolar kids with, budding bipolar disorders or prodromal, they can be incredibly explosive. Autism, of course, or you can have all 3 together. So, but the functional behavioral assessments tend to really hone in on what are the triggers, what's the motivations, how can we, essentially motivate the behaviors we want and reduce the behaviors we don't want by understanding what's driving the behavior. So it's a pretty cool thing they do. But the schools are actually doing ADOS evaluations now also. So the ADOS is the gold standard objective assessment for autism. It stands for Autism Diagnostic Observation Scale. It's a 45-minute interactive assessment. There's different modules based on the verbal abilities of the kiddo or individual, and there's numerous subsets within it. Lots of activity-based, conversation-based, and you're scoring what you see. So young kids, one module might be you're blowing bubbles, and you're looking for shared, joint attention, shared excitement. Are they, or is it more one-sided? There's modules where you give them pieces that they need to finish a puzzle, but you tell them, oh, I've got the remaining pieces with me. And when they come to the point where they need more, you see what they do. Do they look at you and ask for more pieces? Do they get stuck? Do they just, walk around and try to grab them out of your hand? And that's just another way to assess their social, verbal and social abilities and eye contact. And so it goes on and on and on. What I find concerning somewhat is because it's a interactive, standardized assessment of individuals with autism, and you're scoring it based on what you're seeing, you have to know what to look for to correctly score it. So it, in my opinion, it relies heavily on the experience of the evaluator. Because if you don't know what you're looking for, you're not going to see it. Or if you're not sure what behaviors, might be more consistent with ADHD or anxiety versus classic for autism, you may overscore or underscore. And so, small example, I have kids that come in with an ADOS from, what I feel like is probably just, they mean well, but probably just more inexperienced assessors, and the kiddo in my office is walking on tiptoes. They're doing the close visual inspection. There's clearly restricted repetitive behaviors. And I've seen ADOSs come back from outside evaluators with 0 on the restricted repetitive subscale. And I think it's because they don't see it. They're not looking, they're not, or they see it and they don't know. But ultimately, if you're the squeaky wheel and you push hard enough and the parents are on there with you, you can usually get the system to, get the right accommodations in place. And so for autism, you often see things in schools, they have access to noise canceling headphones when they need it. They have reduced work. Maybe they only do every other problem instead of every problem. They have extra time to complete assignments. They have access to a quiet space or to a trusted adult if they're starting to feel overwhelmed. So just, accommodations that can help them. And then just like in the home environment, when the teaching, the whole school and teachers and administration understand it for what it is, that helps a lot. Many children with autism are disciplined, I think, unnecessarily through ISS and suspensions. It's not helping anything, and it's behaviors that they really don't have a whole lot of control over. So that's number one. The therapies are going to depend on where they are on the spectrum of autism. Lower functioning, especially younger, you want to get them into ABA. Or any of the therapies that are also evidence-based, like ABA. ABA therapy is applied behavioral analysis, and in my opinion, tends to be most effective for the more severely, affected children with autism. It can be several hours a week, I think up to 30, 40 hours a week even. ABA therapy can be provided in centers where you drop your child off and then you pick them up at the end of the day. There's models where they come into your home and do ABA therapy at home. But there's a myriad of goals what they're trying to work on based on, the struggle areas of the individual child or family. It's a lot like the functional behavioral assessments that we talked about earlier. They're really, trained to try to identify trigger points, especially for explosive, outbursts, mood dysregulation, behavioral dysregulation, trying to identify what the triggers are and how to modulate that. There's also, they teach in very concrete stepwise fashion activities of daily living. So things like potty training, brushing teeth, getting dressed. So it's a complex topic. But it's evidence-based and shown to be helpful. And particularly between ages, 3 and 5, 4 and 6, if they're more severely affected, it tends to be caught earlier. ABA is a gold standard therapy to get them into. If they're higher functioning, like we were talking about, and if they're in elementary school, kind of approaching middle school, I usually really foot stomp the importance of social skills therapy, really any time in their life. But if you can really hit it hard in the elementary school years, you can help them a lot when they transition to middle school and high school. Because like we talked about, the social abilities with autism, it doesn't come intuitively. It's something they often have to be concretely taught. Even things like what facial expressions mean, idioms, figures of speech. What does it mean? What is sarcasm? And concretely teach them, what that means, or even more basic, how do you approach friends? How do you do a back and forth conversation, maintaining eye contact? So social skills therapy can be really helpful. That can be done through ABA providers, speech language pathologists will provide that service. And then many therapists too, who specialize in that area will provide social skills therapies. And then other therapies, if they're, verbal, higher functioning, and they're struggling with a lot of anxiety or depression, they do well with cognitive behavioral therapy. So talk therapies can be very helpful depending on what symptoms you're targeting. If they need medication support, that is always available as well through primary care, through child psychiatry. Developmental pediatrics does quite a bit, particularly in the younger kiddos. They do quite a bit of medication management. So those are the main treatment modalities that come to mind, and they all look different, depending on what's going on. Yeah.
I want to turn now to leucovorin. I mean, obviously very much in the news, and other vitamins. Let's talk about those types of treatments. So let's start with leucovorin.
With leucovorin, I've been looking into it for, at least 5-6 months now. And it was brought to my attention through a parent who has a child with autism. And, we get a lot of those messages from parents about things that we know have already been proven to not be helpful. I rarely get requests for things that have been proven to be harmful, which is good. But, a lot of requests about nutraceutical sort of things. And, but this one I had not heard of. So leucovorin, so it's folinic acid. So I did a literature review based on her request for that medicine, possibly for her kiddo. And so leucovorin is essentially folinic acid. It's different than folate in that folinic acid can cross the blood-brain barrier. So there's a growing body of literature, but in more recent years, about its application in autism specifically. It was primarily, developed, I think, back even since the 50s for an add-on to chemotherapy type medications that can cause, reduced levels of that vitamin. And so it's got a lot of safety data, I would say. It's been around for a long time. I think the side effect profile is pretty minimal, but where is it actually effective for individuals with autism? That's still where the growing body of evidence, lies. So I last reviewed this about a month ago, so I can't comment on, since that time, but around a month ago, there were many studies, only 2 of which were double-blind, placebo-controlled. One was small and was pretty small, and one was, medium size. And they did show some benefit in improving core symptoms of autism, which is kind of cool. There's not a whole lot out there that does that. Sure. So things like communication, what I couldn't see in the studies though was, so when they say that, their communication improved based on, whatever rating scale they were using, I don't know what that translates to. It reminds me of the Alzheimer's studies where, you start a medication and there was cognitive improvement. Does that mean functional also? Did it improve enough that they're actually functionally doing better? Or was it statistically significant but functionally irrelevant? So I couldn't see in the studies that, how much the communication improved. Was it functionally translating to a better quality of life or not? I don't know. Mm-hmm. And there is an association with the antibodies that would cause your folinic acid levels to be low. So it's funny because it's interesting because the studies are mixed on that, where they do say that there was more improvement when those antibodies did exist. But some kids without it got better anyway, too.
Yeah, the folate receptor autoantibody test, FRAT. Yes, yes.
Yeah, and there's an association. They say, I don't know how good the quality is of that evidence yet, but children with autism tend to have a higher incidence of that antibody, but not all of them. And then if you look, there's conflicting viewpoints too, though, because there are typically developing children with that antibody that don't have autism as well. And so the science is still growing. I think it's promising preliminary results, but like with any promising preliminary result, you will always have that caveat of much larger trials need to be done to replicate these findings, then multi-study. There's a lot to be discovered. Having said that, because there's preliminary evidence, there's a couple of placebo-controlled trials that were double-blind that both showed, improvement and pretty good tolerability, minimal side effects, and it's been around forever. It seems pretty safe. I also really am transparent with them that, like I said earlier, setting their expectations. What did it actually mean that their communication improved, especially for kiddos that are very, severely affected, and just making sure parents have an expectation about, what could possibly occur. So I think it's interesting. It's just a little preliminary to say that this is, the treatment for all people with autism. I think that's, it's too soon for that.
I'm glad to hear that it seems like it's, safe, obviously. But
safe enough. I mean, there was GI side effects in some. I think there was some behavioral activation in some. So it's not completely without side effects. And what I found with autism is they tend to have side effects. They are much more likely to have side effects to every medicine. I even have kids that even just adding a B complex vitamin, they get noticeably more irritable over time. So we take it away. Things like guanfacine, which should be a calming medicine, sometimes you have to be at babyest little doses and they do well. But if you bump the dose just a little bit, they get more irritable and more agitated. So they're very prone to activation type side effects.
Okay, so we've talked about some of the ways that your doctor can help with your child when they've been diagnosed with high functioning autism. And there's a growing body of evidence and literature out there and marketing around nutraceuticals and vitamins. Are there any vitamins that you generally recommend for kids with autism, or is it very case by case dependent?
No, I 100% recommend omega-3 fatty acid supplements. That's been it's really good evidence that that's helpful. I think it's because over the years, especially more recent years, it's become standard of care to do genetic testing on any individual with autism or anybody with developmental, intellectual disabilities. And I believe that it's through that body of testing that they started to learn about these associations with there's an abnormality in their inflammatory system that's linked genetically. And that drove, I believe, studies looking into the anti-inflammatory sort of medications. But omega-3 fatty acids and acetylcysteine, all of them show a reduction in, most of them show a reduction in irritability associated with autism. They all show some improvement with the restricted repetitive, type behaviors. And you see a similar pattern with individuals with bipolar disorder, where you add omega-3 fatty acids and it helps. And they likewise have that genetic association with inflammatory response. So omega-3 fatty acids, lots of good double-blind placebo-controlled trials replicating efficacy and safety for those specific target symptoms. And acetylcysteine as well. I do recommend that. Well, either or, I'll recommend. If the kiddo has a highly restrictive diet, which many do, it's like Slim Jims and Cheez-Its and, maybe one other thing, then a multivitamin makes sense. Just a regular multivitamin. Those are the main things that I recommend. They're interestingly, the CanMat guidelines, they have it was about 3 years ago, they came out with a nutraceutical practice guidelines, and vitamin D3, this surprised me, vitamin D3 has been shown to help with ADHD symptoms when it's an add-on to medications, treatment for ADHD. So I'll often mention that. Again, I'm of the mindset that if there's, evidence that that it's potentially helpful, at least in some kids, and it's unlikely to be harmful in any way, why not, right?
Right.
And nutrition makes sense. And I think many of us are deficient. And then you add, the sensory selectivity, with autism, their diets make them even more prone to lots of, nutrient deficiencies. And so, yeah.
Well, this has been a really great discussion. I just thank you so much for your time and bringing to us your personal story as well as your expertise in treating thousands, if not tens of thousands of children with autism. So I just can't thank you enough for joining us today.
Yeah, you're very welcome. Thank you for having me. It's been a lot of fun.
This is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
I'm Dr. Vivian Carlin.
I'm Dr. Julia Jackson.
We'll see you next time.
See you next time.
If you are concerned about your child's development or have concerns that your child may be exhibiting symptoms of autism, we encourage you to start with your primary care provider, who will be able to do developmental screening and refer you to further testing or resources as needed.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.